The opioid epidemic has touched many families with often heartbreaking results. You or someone you care about may have experienced this firsthand. This video will teach you how to identify an opioid overdose, how to intervene, and how to use the various formulations of naloxone, such as Narcan, to reverse an opioid overdose. First, what do we mean by the term opioids? And how are opiates different than opioids? Both of these terms refer to the same basic category of drugs. The only difference is that opiates are naturally occurring from the poppy plant, and opioids are synthetically created in a laboratory. The term opioids will be used to cover both. Most people know that heroin is an illegal, dangerous, and highly addictive opioid. What many people aren't aware of are the dangers associated with prescription opioids or painkillers such as Oxycontin, Vicodin, and Percocet. These opioids can also be dangerous and can lead to abuse, dependence, addiction, overdose, and death. What happens when a person overdoses on opioids? The opioids bind to specific receptor sites in the brain and slow down breathing. As breathing diminishes, vital organs like the brain and heart don't get enough oxygen, and eventually the person will die. But this process often takes 1 to 3 hours, which means there's time to intervene. The medication for an opioid overdose is naloxone. The most common brand is Narcan. Naloxone blocks the effects of opioids by stealing the spot of the opioid at the brain receptor site. When the opioid is kicked out of the receptors, the person's breathing resumes while the naloxone lasts. However, naloxone is a short-acting medication and will last somewhere between 30 and 90 minutes, enough time for EMS to arrive and transport the person to a hospital for further medical care. When the naloxone wears off, the person could experience a re-overdose because the opioid is still circulating in their system and could reattach to the receptor sites and again slow down breathing. This is why it's important for the person to go to the hospital for monitoring, even after they've been revived. How do you identify an opioid overdose? First, the person may be unconscious, unresponsive, or minimally responsive. Due to the lack of oxygen, they will look blue or, depending on their coloring, gray or ashen, especially apparent around the lips and fingernails. Their breathing will be labored, less than 10 breaths a minute, or no breathing at all. They will have pinpoint pupils, and sometimes they will make an odd snoring or gurgling sound. Often there is other evidence available. The person could be a known user, there could be pills or syringes laying around, or bystanders who witnessed what happened. The first step is to try and rouse the person by calling their name and shaking them. If you can get them up, walking around and talking, then the naloxone may not be necessary. Also, try using the sternum rub by making a fist and rubbing it hard up and down the person's sternum or breastbone. This causes pain, and generally the person will respond if they can. If they don't respond, call 911 for a medical emergency. When you call 911, provide as much information as you can and describe the person's breathing status. For example, they aren't breathing, or they aren't breathing much. Describe exactly where the person is located, such as they are in the living room. You want to provide as many details as possible so the person can be quickly found by emergency personnel. If you are alone with the victim, it is recommended that you provide some rescue breaths even before you administer the naloxone. Remember, it's the lack of oxygen that causes death. Rescue breathing is CPR without the chest compressions. Make sure the person is on their back on the floor. Open the airway by lifting the chin and tilting the head back. Make sure there is nothing in their throat that would block the airway. Begin by pinching their nose so the air you breathe in does not escape. Give 2 normal-sized breaths and then 1 breath every 5 seconds. After you give a few rounds of breathing, then you can administer the naloxone. Once the naloxone is given, continue with the rescue breaths until the person either revives or EMS arrives to take over. If there is more than one person, one can provide rescue breaths while the other administers the naloxone. Currently, there are 4 formulations of naloxone used in the community. 2 are intramuscular injections, and 2 are intranasal sprays. The first intramuscular injection is the traditional syringe and medication. For intramuscular injection using a syringe, pop off the orange top of the vial, remove the syringe from its packaging, and insert the syringe into the vial. Flip the vial upside down and remove the entire amount of Narcan, 1 cc, by pulling down on the plunger. Remove any air bubbles from the syringe by carefully pushing the plunger in. Insert the syringe into the upper arm or thigh muscle and push the plunger in. The second form of intramuscular injection is the auto-injector. Currently, the only brand of auto-injector is FZO. This product is similar to an EpiPen, and it talks you through the process. Each kit comes with 2 doses and a trainer device. All you have to remember with this formulation is to pull it apart and listen.
This trainer contains no needle or drug.
This injection will go through most clothing.
4, 3, 2, 1. Injection complete.
The first intranasal formulation is an atomizer, which converts the liquid medication to a mist similar to a nasal spray. The atomizer assembly has 3 components and requires assembly. The atomizer comes separately packaged, and the remaining 2 components are inside the box: the medication in liquid form and the plastic housing into which it is inserted. First, remove all the plastic ends. Next, screw the medication into the bottom of the plastic housing. It's important to stop when you feel resistance, otherwise the liquid medication will start leaking out the other end if you go too far. Note that this device contains 2 milliliters of naloxone, 1 for each nostril. Finally, screw on the atomizer as straight as you can. Insert the device into one nostril and squeeze in half the amount, then do the same in the other nostril. Finally, the newest intranasal formulation is a device that requires no measurement or assembly. This is the Narcan nasal spray. There is a very small volume of liquid in this formulation, so just select one nostril and squirt the entire amount by holding the device with your 2nd and 3rd fingers around the nosepiece and your thumb on the plunger below. Insert into the nostril just until the tops of your fingers touch the bottom of the person's nose. Then push up with your thumb. It is recommended to have your other hand supporting the person's neck and tilting their head back to ensure that none of the medication rolls out. Cost and dosage varies with these different formulations. Most commercial insurance, as well as Connecticut Medicaid and Medicare, will cover at least some of them. Grants or coupons might also be available on the websites of different pharmaceutical companies. Naloxone will expire in about 18 months, and it should be stored in moderate temperatures, not in the refrigerator and not in direct sunlight. What can you expect after you administer the naloxone? It may take a minute or 2 to work. In the meantime, you need to continue with the rescue breathing. If the person does not respond within about 2 or 3 minutes, you should give a second dose. When people are revived, they may be confused, upset, or even agitated. Actual combativeness is reported only about 1% of the time. Explain to the person that they have, in fact, been brought back from an overdose. If the person is dependent on opioids, they will be experiencing withdrawal symptoms, so prevent them from using again to relieve these symptoms. Ideally, the person will agree to go to the hospital, where they are typically monitored until they are deemed to be medically stable. People generally don't realize that they are overdosing. That's why it's so important to get naloxone into the hands of family members and friends. Communities across the country are becoming more involved in activities designed to reduce opioid abuse and overdose. Naloxone is an invaluable, life-saving resource in these efforts.